I think one of the things I've learned is that, like, number one, every organization, every provider will use a lot of these terms either differently or interchangeably. And I don't quite think the industry has really clarified, let's call it a universal way of looking at these topics.
Hmm.
But I do think ultimately there are all kinds of technologies or technology enabled services that exist on a spectrum in healthcare now. And I think more and more organizations realize they're going to have to implement these types of technologies at some point to kind of support the patient across the entire continuum of care, across the entire patient journey. But I think a lot of organizations have started in different places.
Hmm.
So maybe, Alan, would be good to start with kind of definitions then, I guess. Um,
Absolutely, yeah.
or maybe did you want to start with myth number one, and then we can go into definitions?
Sure, and I actually think myth number one is a perfect segue to get into some of these broader definitions and more specific definitions. The first myth that we're going to talk about is we hear it all the time, but digital patient engagement is synonymous to or synonymous with telemedicine and or virtual care. And there's a lot of terms in there that would probably be best if we could define them. So maybe Josh, if you could talk to kind of the definitions behind what is telemedicine, what is virtual care, and where does digital patient engagement fit in both of those spaces?
Yeah, I think I mean I think the Oxford definition, as you've kind of alluded to, of telemedicine is the remote diagnosis and treatment of patients using telecommunication technology. Um, but that's very broad, right? So technically, if you speak to a patient by phone and manage an issue, that's telemedicine. More recently, if you're using video visit technology to manage a patient issue or have an appointment with them, that's telemedicine. And so I think the way I think about telemedicine and is just the idea that are there certain real-time interactions that you would normally do in person that can be done remotely through typically, I call it telephone or video conferencing. I think that's probably a pretty good definition of it.
Yep. And
And go ahead, Alan.
so an app, would that then fit within telemedicine in some regard? It's using a
It could.
telecommunication platform. It
If
certainly could.
if the app was Zoom, I guess so.
Yeah.
And I think that's where it gets a little bit fuzzy because if we're talking to provider and we're talking about if you use a very general term such as using an app to connect a physician and a patient or to facilitate communication, without going into details of what type of communication or interaction we're talking about, a provider who's used a telephone or video visit service will think, okay, that's kind of the same thing.
Mhm.
And so I think the devil's in the details, but you can see why a lot of times when we talk to providers for the first time, they might think, oh, I already have a video visit service.
Right.
Maybe I don't need something like Seamless, even though really video visits are not core to what we do. It just,
Mhm.
when it comes to the umbrella of communicating with the patient or engaging them in technology, a lot of it just sounds kind of similar, and I can appreciate that.
Mhm. And then, so another kind of broad term that's kind of this umbrella to all of these technologies is this kind of new space of virtual care. It's expressed all around the internet and around research as a broad term that encompasses all the ways that healthcare providers remotely interact with their patients. So it sounds very similar to telemedicine, but it could actually include telemedicine. So live video, it could even be audio, instant messages, any way to communicate with patients and really get them care remotely. So that's kind of how I look at virtual care and how virtual care is kind of being described on the internet these days. So looking at these two definitions, telemedicine and virtual care, where does digital patient engagement fit in, and how do you kind of view digital patient engagement either separate from those two terms or really as a specific inside of those terms?
Yeah, I think the way I view it now is like virtual care is very much the umbrella term for like pretty much anything virtual or digital that you do to engage with or communicate with the patient. So for me, at least, I would put telemedicine under the umbrella of virtual care. I'd
Hmm.
probably put digital patient engagement under the umbrella of virtual care. I think the way I would describe it is telemedicine is when you're using technology to actually deliver the real-time communication. So if you're having an audio phone call, if you're having a video chat with the patient to replace the in-person real-time communication, that's telemedicine. And for me, I would say digital patient engagement is how do we actually use technology to interact with patients in between those real-time encounters. So the idea is that Seamless as a digital patient engagement platform is engaging with the patient, between those visits. So, before you go to the hospital for your surgery, Seamless is the digital platform that is reminding the patient of what to do, is the platform that's checking in with the patient to track their progress, delivering, asynchronous education to the patient by text or, illustration or video. And then when they go home, Seamless is the platform that's checking with the patient to get them to track their symptoms, their patient-reported outcomes, warning signs, take photos of their incision. All of these interactions are happening in between actual visits with the healthcare provider. And so I think the idea is that telemedicine is great for replacing the in-person communication, especially during COVID, and digital patient engagement like SeamlessMD covers the rest of the time, which is frankly 95% of the patient journey. You're not with your doctor or nurse in real time. You're actually trying to take care of your health, on your own. Seamless is that communication or that platform for the rest of the continuum, basically.
Got it. Yeah. So digital patient engagement, if I'm understanding correctly, is kind of this automated virtual care that is meant to guide the patient in the background between these real-time visits, whether they're telemedicine or in person, the way that's being conducted. Basically, if you look at kind of the end goal, how do we get each patient, the right care at the right time? Maybe a video visit, maybe telemedicine is absolutely useful to connect with the patients, but there's got to be something that's guiding the patient along the way, getting them care in the background in between these visits. And that's kind of where digital patient engagement fits in.
Yeah, absolutely. And I think another couple of things to mention is, number one, in many ways, digital patient engagement might replace aspects of telemedicine and virtual care, right? So if we can nudge the patient along or monitor them and catch something earlier and help a patient resolve the issue, sometimes even on their own. So, in Seamless, if we can track that a patient is constipated and then serve them up constipation content, well, maybe they didn't need an actual telephone call or video visit with their care team to address the constipation because we preempted that with the patient engagement piece. So there's lots of ways in which good patient engagement digitally can replace telemedicine. But the other thing I think about, Alan, is it gets fuzzy because there's a lot of overlap between, I think, what different platforms can do. So as you know, it's Seamless, we've enabled video visits on our platform too, right? Either we hook up to and integrate workflows with existing video visit platforms the health system uses, or maybe they want to use ours out of the box. And so I don't view Seamless though as a telemedicine provider. It's just that it makes sense that since the patient is so engaged with Seamless, some of their providers might want the patient to engage in video visits through the Seamless platform because they're already engaged with Seamless normally. But again, that doesn't mean that we're trying to turn Seamless into a telemedicine platform. It's just that the patient journey starts, growing, pretty beyond the in between the visit piece. We can actually start helping the in visit piece. So, anyways, that's where it gets hazy because all of this really connects along the spectrum.
Totally. Yeah. There's certainly a lot of overlap. And that actually kind of fits in really well with myth number 2, which is, is digital patient engagement pointless because there are video visits? And I think we've already kind of gone over that answer and debunked that myth. But just to summarize it again, digital patient engagement is a useful tool in figuring out, does the patient actually need a video visit? So it's doing kind of that background screening effort of finding out, what are the symptoms the patient is experiencing, what is, all the different measures that we're collecting from patients, whether it's other patient-reported outcomes like pain or compliance to certain milestones that the patient is following. So really helping the providers to understand, is a video visit necessary at this point in time for the patient, or can I just rely on these, wound photos that I'm seeing from the patient ahead of time and follow that automated journey, ensuring that the patient is getting the right education based on what they've put into the system. Do you have anything to add there? Or I think we've maybe covered myth number 2, but.
Yeah, I think the thing I'll add is that I would say video visits been around a long time, and it's kind of the low hanging fruit when it comes to virtual care more broadly, just because it's something that replaces an existing workflow. So, in person, real time communication visits is an existing workflow for providers and patients, right? They're used to coming into the office or the hospital and having these meetings. So the fact that, especially during COVID, video visits increased so that with that type of encounter could continue remotely, it makes sense. That's a low hanging fruit. But here's the thing: a video visit is just an in person visit done digitally. So a video visit is not going to magically improve a patient's outcome. Right? Having the visit done virtually doesn't all of a sudden prevent a readmission or all of a sudden reduce length of stay or improve a patient health outcome. And so I think what organizations are realizing is that, video visits were kind of step one, low hanging fruit, the easiest thing to digitize. And step two really is digital patient engagements. Okay, well, now that we've digitized the real time encounter, how do we digitize everything in between these encounters?
Mm-hmm.
Because that's really where the patient falls off track. And then to your point, Alan, if we can actually, combine digital patient engagement with telemedicine or the video visits and really support the patient digitally the entire way, we're going to pick up a lot of things that you mentioned. We're actually going to find out sooner. Maybe they need a video visit sooner. Maybe they don't need a video visit. But I think the thing to realize is that these are really complementary pieces.
Mm-hmm.
But I think it's understandable that video visits really were the low hanging fruit for many years, especially during COVID. And I think what we're finding from our partners, Alan, is that the folks who already had video visits in place are kind of now seeing digital patient engagement as the next thing they add on. Maybe for the folks who haven't done anything digital yet, video visits are kind of the thing they have to do first before they go to the digital patient engagement. I think that's happening too.
Yep, certainly. So it's like video visits is part of the new workflow of the digital healthcare, and then digital patient engagement is kind of the workflow optimizer to make sure all the pieces are even smoother, and even around like time management, for instance, it's gonna affect that area as well. All right, let's move on to myth number 3. The third myth we hear with digital patient engagement is that it's only for young patients. It's only patients under 65 can use the type of technology. Why do you think this is a myth, first of all? And maybe you can speak to how we actually see it in from the frontline experience.
Yeah, I think a few things. I think one of the reasons is that I think we tend to underestimate some of the senior citizens in the population. We often underestimate what they're capable of. So I think that's just an ongoing stereotype that, frankly, should naturally go away because, these stereotypes, can older folks use technology have probably existed for like 20, 30 years. Well, people who were 30 or 40, 20 years ago are now 50, 60, right? So the people, like the 65-year-olds now, right, have had the internet since the the mid 90s or at least the early 2000s, right? So if you're 65 now, you started the internet when you were 40 something.
Mm-hmm.
And so a lot of 65-year-olds I know personally are like very tech savvy,
Mm-hmm.
right? And that ease of use is only going to increase as this group, as the baby boomers get older and older over the next 20 years. So even if these stereotypes were true, they're going away.
Mm-hmm.
They're absolutely going away just through like the laws of time. And I think the other piece too is that folks don't realize that there's different channels for engagement. So often, I think Alan, you and I both talk to providers, and when they hear about digital patient engagement, they kind of assume, oh, this is a smartphone only thing.
Right.
So if my patient doesn't have a smartphone or can't use it, that's it. It's like, well, no, there's other mediums, right? It could be a tablet, like an iPad, so it's bigger, more useful, or usable for certain folks. But also, you and I have talked about this, like something like Seamless on the web as well.
Mm-hmm.
And so we have some folks who do things on their browser, their laptop, or whatnot. And even the extreme case, which is there are some older folks who only have an iPad and they can use it, but they don't know their app store password, so they use the browser version of Seamless on their iPad. So my point being that yes, there's definitely barriers to access, but as long as you're multi-channel, multi-platform, you can reach a lot more of these patients than you would realize.
Right. And for instance, with Seamless specifically, it doesn't have to be delivered through the app experience or delivered through even the web browser experience. It can be delivered through a text message or an email and then accessed through the web. No apps involved at all if that's the route that we need to go. The other
Oh,
piece that
Alan, one more thing. Here, and this is where it gets, I think, potentially hypocritical if you go down the route of no one's going to use this because it's on, you know, phones, tablets, or computers. It's like, well, number one, all these health systems have invested in websites for years. So if you truly believed it wasn't accessible,
right,
like why would you have a website? Obviously, you
good
think
point.
it's accessible.
Right,
Or two is why would you have a patient portal? Obviously, you think it's accessible enough to, or at least enough that you should invest in one.
right,
And if anything, Alan, like digital patient engagement platforms like Seamless have invested far more in accessibility than most patient portals, if not all
absolutely.
of them.
Yep.
Like, I don't know how many patient portals meet health literacy guidelines or colorblind tested, visual acuity tested. I mean, if anything, we've seen far higher adoption of Seamless than patient portals. So if you think they can use patient portals, 10 times more can use something like Seamless. So I'm
Yeah.
just saying, not to toot our own horn, but we put in the time.
Absolutely. I think just kind of rounding out this answer, what's neat about digital patient engagement is it's using technology that we have today. It's not some, super advanced technology that's, VR and AR and kind of next gen technologies that, even younger folks wouldn't really understand or might need a bit of a learning curve. It's using the technology that we all have. So for instance, I saw a recent study, this is from the Pew Research Center, and they were looking at seniors over the age of 65, how many of them actually own a cell phone and a smartphone. And it's actually up to 85% now. So it's using technology that they use to connect, they use to access information and connect with others, communicate with others. So it's just using that same technology and repurposing it. And then the last piece that I'll add, and this is also specific to SeamlessMD around digital patient engagement, but the ability to enroll a caregiver as well. So if there is that extreme case of, patient is 90 years old and they actually are not on the internet, they're not using technology in that way, chances are they have a son or a daughter or someone in the family who can follow along with them using their own device. And we've enabled that caregiver function on the platform as well.
Absolutely.
Cool. So we'll jump into myth number 4. This comes up sometimes that my EHR or my EMR can do this already. This is an interesting myth because there are definitely some prominent technologies out there like Epic and Cerner, for instance, and they've built tools like MyChart and patient portals. And I think these portals and these patient applications are really good for certain things like lab results. There is some communication in there where they can get certain instructions from their providers. Do you want to expand on why this is a myth and what the reality is around this myth?
Yeah, and I think what happens is if you talk to providers, right, and then you describe something like digital patient engagement, in their minds they go, okay, Alan is talking about a patient app. Oh, we have a patient app called,
Right.
Epic MyChart, for example. But to your point, the purpose of MyChart really is to be a portal, which is, like you said, access test results, um, maybe some secure messaging, maybe learn a bit more about things at the health system or whatnot. But the way that we think about it is an application is just software, right? And there's so many different types of software to solve so many different purposes, right? I mean, imagine you had a computer and you had Microsoft Word on it, and someone told you, oh, I have this idea for spreadsheet software. You're like, oh, no, I already have desktop software. It's called Microsoft Word. It's like, no, it has a different use case, right? So in the same way, I think people are starting to realize now that, hey, just because there's an app for a patient doesn't mean it does everything that I need to do with the patient. It'd be nice if it did, but the truth is that patients are complex, and the type of workflows and insights, and not even just features, but know-how you need to have in a software to engage a patient is very different than the software needed to simply list test results. Frankly, it's much harder to engage a patient to change an outcome than to just show lab results, right? So, and I think organizations and providers are starting to realize that. But I can see why, if you just think about it as a patient app, you feel like you already have one, maybe if you have a patient portal that's working quite well. I will say though that, we've heard across the board that adoption of patient portals is not anywhere near as high as people want. It's often in the maybe 20, 30, at best 40% range is what I hear from providers. And I think part of whereas with Seamless, it's often, 80, 90% plus adoption for patients. Why is that? And I think part of it is because something like Seamless, number one, is obviously very, very well designed for patient engagement. But two is when you're getting Seamless, it's because you're trying to deal with some important life event for your health, right? Maybe you're undergoing a surgery or cancer journey or chronic condition. So at that point in time, the patient is very primed to want to be engaged to manage something. Plus the engagement is very strong on the platform. But you can imagine why, well, if all I'm going to get out of this portal is access to a potential test result in the future,
right,
what's my incentive to log on daily? What's my incentive to log in the first time, unless there's something I need to see? And so I think what's important to realize is, number one, there's different use cases for patient engagement versus patient portals. And number two is, it takes a very different set of insights and workflows and algorithms and things to make patient engagement work, which is very different than having a patient portal, even though it's in this container of an application.
Right.
Looks
Absolutely.
the same, totally different.
It's the same, persona who it's for patients. So, in your mind, you're going to categorize it the same way. So it makes a lot of sense. Another point that I'll just add here, those leading EHRs that I mentioned, Epic and Cerner, for instance, they've even recognized that there's a gap, that digital patient engagement is solving a different problem, or it's going after a different use case than the different apps and the different software that they've built. And so, for instance, with Epic, they've created what is called the App Orchard, and Cerner has created the Code program. And in both of these use cases, in both of these kind of online catalogs, they've included SeamlessMD as a recommended digital patient engagement platform that integrates really nicely with Epic and Cerner. But that's because they realized this is kind of like an add-on to the Epic experience for providers on the patient side. This is an add-on for them. Same thing with Cerner. This is an add-on to what the core product can do. Myth number 5, and this comes up actually quite frequently. This is, my nurses can do exactly what digital patient engagement does. And this is an interesting one because I think the short answer to this is yes, a nurse or a person could do pretty much exactly what digital patient engagement does. The caveat is that it would take probably 24 hours a day, every single day, and it's definitely not scalable. But maybe let's dig in a little bit more into that answer and really kind of debunk this myth. I think a good place to start is understanding what the different functions of digital patient engagement is and what does it actually do. Do you want to kick that off? I feel like you're able to kind of describe that really nicely.
Yeah, I mean, one thing is that everything on something like Seamless is available 24/7. So, I mean, the fact that a patient could wake up at 3 a.m. and get questions answered on the platform, or log an issue, or look up something. And if you multiply that by how many patients you might have on the platform, yeah, even that alone gets unsustainable. The fact that there's messages sent to the patient on a schedule, right? Reminding them of when to, stop blood thinners, when to do certain exercises, how to manage their diet, when to show up for, certain preoperative appointments, for example. There's just so many things in the protocol that the patients have to follow, and a platform like SeamlessMD can just keep them on track with those steps. To your point, yes, a nurse could call a patient or text the patient manually every time they need to do those things, but that's just very, very labor intensive. And then there's, collecting data from the patient, collecting patient-reported outcomes, collecting data on compliance with instructions, collecting data post-operatively on, is the patient feeling well, what's their temperature, what is their pain looking like, nausea, vomiting, all kinds of other issues. And again, you're right, you could call a patient and maybe get some of these things and then have to give them feedback on what to do. And then of course you got to document this, right, Alan? So then you got to go in the chart, you got to record all these symptoms, got to turn into a graph. And so the point is that theoretically a staff member could do all these things. And I think to some extent they do, right? There are some programs where a nurse might call a patient to remind them of something or to capture data about patient progress or see how they're doing. But even in the few cases where this does happen, often this doesn't even happen, but in the few cases that it does, because you're a better resource organization, it only happens a few times in the patient journey, right? So maybe you get a call a couple of days before surgery to remind you to do one or two things, right? Or maybe you get a post-discharge 48-hour phone call when you go home to check in on how you're doing. But that same provider is not calling you day 3, 4, 5, 6, 7, all the way to 30. They're calling you once.
Right.
And great if you're doing well on, day 2, but if something happens to you on day 7 or 10 or 15 when you go home, no one's calling you then.
Mhm.
And so these are all, to your point, theoretical things that a staff member could do. And some of it they might be doing, but usually they're not doing all of this stuff, and they're not doing it as frequently.
Right.
And digital patient engagement lets you do it at scale.
Yep. There was also a study that we did with McGill University, and I think this could have been the first study in 2015 or the follow up in 2017, and I might be mixing up which one it's from. But they found that on the using digital patient engagement and specifically SeamlessMD, they were able to collect 50% additional data from a patient compared to an in-person auditor. And that could just simply be, maybe there is a checklist that a nurse or a PA is running through and asking of every patient, but there's patients with unique comorbidities. Maybe you need to change some of the questions because of that profile. There's also just additional questions that may not have come up in the moment to think about. And it could be, things like on digital patient engagement, you're able to collect things like opioid use and then consumption post-discharge. So how many pills did a patient actually take? And what's neat, digital patient engagement, because we don't have to manually add all of this data into the patient's chart and run graphs separately and do all this work, digital patient engagement does this automatically. So providing real-time dashboards on any type of complication that a patient might have, like you said, it's not just post-op day 2 that we're calling, but we're actually finding out every single day for, let's say, 30 days post-op what's going on with the patient. So providing those dashboards that kind of flag any potential complication, showing any type of population trend. So if we're looking at pain scores across the population, that's, real time, we're able to see that very quickly. Same thing with, like I mentioned, opioid use, measuring that for the population. Pretty much any type of patient reported outcome is going to be tracked automatically, and then the trend for the population can be displayed automatically as well. And then I think the last point that I have for this myth on nurses can do what digital patient engagement does is if we look to the future of digital patient engagement. So we're collecting all of this data. We can now combine it with the historical outcomes data. And with those two data sets together, you can train models to predict maybe a lot better in real time what is the risk of a readmission, for instance. What's the percentage that this patient is actually going to come back to the hospital? And I think you'd be hard pressed to find a nurse that can do all of this data collection, all of this data entering, as well as tracking each and every patient that they have. It's just not scalable in my eyes to then do that kind of next step that's needed for a digital healthcare.
Yeah, on top of that, a couple more things to add to that, Al. I mean, from a how do we do this at scale point of view, one of the powerful things about technology is being able to do things in a very standardized way. So, I mean, imagine as an organization, or even just as a department, you've decided to change a protocol step, right? And you have staff members, whether it's nursing, PAs, physicians, whoever it is, often they're rotating in or out. If you're an academic center, you have like residents and students and trainees. And so often, not everyone is equally trained on changes in protocols. So the fact that on a platform, you could just change the protocol once and make sure every patient gets the protocol change, or if you want to start collecting a new data point, be able to just program that once into the platform and not have to train every staff member to collect this new data point. It's just being able to operate at scale and be nimble and dynamic in how you're caring for patients is frankly impossible if you're doing everything manually.
Right.
It's just like the overhead of training everyone and making everyone consistent. It's impossible to do properly. And then the other point I just add is like everyone always wants every provider to be being able to perform at the what do you call it, at the highest level of care that they can provide, right? So yes, like a frontline provider, like such as a nurse or PA or even physician, could theoretically call a patient, deliver the educational reminder, or collect the patient-reported outcomes survey data. Sure, but why not have that person take care of the sick acute patient issues that only they can take care of, instead of having them do these things that can be automated? Frankly, you're able to let them operate more at the top of their game than having them take care of these tasks that frankly a platform could. So there's those benefits as well, just getting the most out of the team.
Yep. Team, and you've already mentioned it, but it's a small change in there as well. The team performing optimally and the right information standardized. Also education booklets. So for instance, paper, if we're giving our patients all of these different pages of instructions and education, it's maybe not going to be the most tailored to that particular patient, whether it's comorbidities related or nuances in their actual procedure. And then B, if there is a change that needs to be done to the education, are we going to go out and print, thousands of new resources, new materials every year to keep up with the best practices? Or again, is it one change in the back end and it updates for everybody? So not just people, but also the materials that we're giving out as well.
Absolutely.
Myth number 6 that we have, and we hear this especially in the earlier days, but even today, it's easy to go out and build our own app or our own digital patient engagement tool. We can hire a development shop and we can build it ourselves and do it ourselves. And to that, the first thing that I'll say is you definitely can. You absolutely can go out and build an app really quickly these days, with the right amount of money or not even money, just time. It's not too complicated to build an app. But I think beyond there's a whole level of different intricacies that come down to what an actual successful digital patient engagement platform is. Do you want to talk to some of the differences in terms of a particular company versus building it yourself or a dev shop?
Yeah, and I think, Alan, the way I look at it is, using SeamlessMD as an example. We've been in business for about 7 years now, right? Which means that we've spent, millions and millions in research and development and engineering and design and things like that. It means that we've spent tens of thousands of hours developing, iterating, rebuilding parts of the platform. Much of this based on learnings from, thousands and thousands and thousands of patients and providers, both qualitative feedback and insights from the data of all the patient interactions on the platform. And so my point being that, if it was just as simple as make it once in a few months to a half a year or even a year and set it and forget it, and you're never going to have to touch code again or make changes to the user experience or all these things, if that's all it took, we wouldn't have had to spend millions of dollars ongoing in R&D and tens of thousands of hours or more of people time to continuously improve the platform. Clearly, there's a reason we're doing that, which is because there's always new functionalities that we're building to advance the platform to meet the demands of providers and patients and all kinds of novel ways to improve patient outcomes. So the first point is that, yeah, you could build probably a very lightweight solution that has, like, frankly, mediocre engagement, maybe even like no real change in outcomes. A lot of groups have done that, and then they kind of realize, whoa, this is actually harder than we thought. And so if all you wanted to do, if your goal was to just have a patient app that showed information on it that theoretically could capture data, you could spend 50, 100K probably, or maybe a bit more to do that. But if your goal was to actually get high patient adoption and change in outcomes, and you want to actually meet all kinds of requirements that you're going to need, like EHR integration, advanced functionalities, advanced workflows, all these things, it's going to be hard to do that. And I'll give you an analogy, Alan. It's okay. Yes, I could theoretically hire some developers to build a much crappier version of Zoom or Microsoft Word or pick your software application, but like, why would I? Right? Like, why would I want to spend $100,000 to create a much worse version of something that I can basically rent through software as a service that's going to keep getting better?
Right.
right? And there's a whole host of other things you get into, Alan, around like, okay, well, even if I build it, how do I get patients adopting this?
Right.
Because I can tell you, we have 7 years of trial and error to figure out what's the playbook to get patients to use this and providers to engage,
Hmm.
right? We have, ongoing maintenance we're doing on a security platform maintenance point of view,
Hmm.
right? Um, and et cetera, et cetera.
Well,
So
actually,
it's
Josh, I
yeah.
think maintenance is a really fair point as well. With the Microsoft Word example, on my laptop, I updated the operating system, and all of a sudden, Microsoft Word didn't work anymore until I went and realized, oh, there's an update for Word as well, and I download the update, and then it works again. But same thing would happen presumably with an app that you build. As soon as the new iPhone comes out, the new phones come out, and patients get a hold of those devices, your app might not work on these new devices anymore. So maintenance and updates, that also applies.
Yeah, and like, I mean, I don't think we should be naive that thinking that if we just do this once, that let's say you didn't have to deal with like the operating system needing change and having to update it, right? You're right, that is true, but like, are we really that naive to think that the frontline providers won't be expecting improvements in the platform?
Hmm.
So that's got to come from somewhere. And so, are you going to hire an entire engineering team dedicated to this platform to basically build this platform, interview patients constantly, look at the data, basically, frankly, build a company inside the organization?
Hmm.
I can tell you the development shop's not going to do that. The development shop is incentivized to push out that one-time application, get paid for it, move on to the next project.
Right.
Um, and I can tell you that it would cost them millions and millions and millions of dollars to get something anywhere, hopefully not even as close as Seamless, let alone
Right.
another like 5+ years to get there. You could, I mean, like, why would you? It doesn't, I mean, it doesn't make sense. And I think what we find a lot of providers, once they've gone through that journey and they realize,
Right.
oh, like this is a lot more complicated than I realized, there's a good reason why we don't try to build Microsoft Word in-house.
Right.
It's the same for healthcare technology solutions. It's no different.
Hmm. Yeah, absolutely. Our last myth that we got is digital patient engagement is only valuable with big amounts of data or artificial intelligence or machine learning. And I think this is an interesting myth because there the word only is only valuable is kind of the mistake here, is the myth. It is certainly valuable and even more valuable with artificial intelligence, with machine learning, with big data sets. There's no one arguing that point. I think creating accurate models based on real-time readmission prediction makes a lot of sense based on lots and lots of data to make improvements to the platform. Even when we were explaining myth number 6 about developing the app, you know, leveraging real patient feedback, that makes sense. That's going to make a better technology. So I don't have a problem with the idea that big data and machine learning and artificial intelligence, it makes the app better or more valuable. But the myth really comes down to certain people who think that digital patient engagement is only as good as the data that it has. Do you want to speak to a little bit about this? Because I know that you're currently working with SeamlessMD on the supercluster initiative, kind of building this future here. But what are your thoughts on this myth?
Oh, I mean, we know it's a myth because, even without using a lot of machine learning, previously in the platform, we still got fantastic outcomes. I mean,
Mhm.
the idea is that if you can just get patients following their instructions more closely, they get better outcomes, right? We have lots of data showing that by simply engaging a patient digitally with no real AI involved, but getting them prompted to follow the right instructions properly, length of stay is shorter because they're recovering faster, they're mobilizing earlier, they're managing their pain better, they're better, their prehab before surgery better,
Mhm.
or then even just, I mean, after discharge, it's common sense, right? But if you could simply just keep an eye on a patient's symptoms, their recovery status, and call them if they're starting to fall off track, call them if their temperature is starting to trend up, if their pain starting to trend up, and then manage that issue earlier before it leads to a readmission. You can keep them healthy at home. None of this requires machine learning.
Right.
It's really just using technology to better support a patient, frankly.
Mhm.
But to your point, Alan, absolutely. I think there's huge opportunities with AI, machine learning, and leveraging all the data that we collect to enhance this even more. But I think folks who are waiting for that moment are really missing out on how much value there is from the foundational layer of digital patient engagement.
Mhm.
You know, it's you don't need a really intelligent system to get really big benefit from engaging the patient digitally. We've
Right.
proven it. Um,
Yeah, exactly. I think, like, obviously everybody's talking right now about new bundled payment programs and the changes that CMS made. And really what it comes down to is, can we perform better on outcomes like length of stay, on readmissions, on the amount of patients going to, let's say, like a skilled nursing facility? Can we improve on those outcomes? And using the current technology, so not even AI, not even machine learning, we've proven that's possible. You can certainly reduce those outcomes, reduce phone calls, optimize the workflow just with the current technologies. And then what's kind of beautiful about everything in digital patient engagement is, by implementing it with a current version of, just getting the patients the right information at the right time, um, you're able to then collect your own data. And so you're collecting data with the tools that you have at hand. And so then that future where big data and artificial intelligence and machine learning makes everything greater, you're actually contributing to that future for yourself because you're collecting the data now. So it's I used to think of it kind of as a chicken or the egg thing, but I really do see it as, this is step one. Step two is, you need the data to get there. So yeah.
Absolutely, and it's great that people are being very visionary about what you could do with all the data. But I think where we've seen the biggest success with our health system partners is less about who's visionary about patient engagement 10.0. It's about who's nimble enough to capture the lowest hanging fruit, put it into practice, make it feasible and practical inside the clinical workflow, get it into the hands of patients. Frankly, those are the ones who are most successful because the technology isn't so much the hard part, right? It's the change management.
Mhm.
It's getting this into the workflow. It's rallying providers around this new initiative. Like that's really, for some organizations, the more challenging part, to be honest. That
Yep.
the tech stuff is doable, right?
Yep.
Has to be good tech. Don't get me
Mhm.
wrong,
Mhm.
but once you've picked a good technology partner, it's all about change management.
Yep.
And I can tell you that there is definitely a correlation between how engaged providers are in the initiative and how engaged patients are. Same
Absolutely.
goes with any intervention.
Yeah.
The enthusiasm, the involvement, the engagement of the providers has a huge impact on adoption of digital patient engagement or virtual or video visits and other technologies.
Mhm. Yeah, I just want to add kind of a shameless self promotion here, but our ninth episode of the Seamless MD podcast was on the best practices for implementing digital patient engagement. And I think you can replace the word digital patient engagement with, another technology if it's a video visit software or something like that. But I think the best practices in there, in that episode in particular, kind of speak to exactly what you're talking about here, is how do we work that change management? How do we go about figuring out what is the right steps to take in order to make change in the hospital setting. And so I think that's a really good episode to highlight as well. Um, but I think we can end this here. Those are kind of the top 7 myths that we hear all the time about digital patient engagement. And I hope that there was some value in us taking the time to debunk some of these myths and maybe clarify a few definitions here and there. It definitely helps me think better about the technology and understand where it fits in with virtual care and how it's maybe perceived as a telemedicine platform, and also what we can do in the future with the technology as well. So thanks, Josh. Thanks for joining the show today. Thanks for talking about some of these myths and really blessing our audience and myself with some of this knowledge and wisdom that you've picked up over the
Hey, I
years.
mean, likewise, Al. I always learn when I'm talking to you about this stuff, and I think it's nice that we get a chance to really think out loud and kind of massage some of these ideas together. So I appreciate you taking the time as well. Thanks for having me.
Definitely. Amazing. Thanks, Josh. We'll see
All
you
right,
next time.
see you, Alan.